Hi everyone, my name is Amanda Krzyzewski and I'm a speech-language pathologist at A2 Therapy Works. And today we're going to be talking about an autism spectrum disorder evaluation, who you might meet there, and what kinds of things to expect when you go in for an interdisciplinary evaluation. So I have a list here of all the different professionals you could see at the evaluation. If you want to pause at this part, I have the full list. We'll go through all of them. But first, I know a lot of our families have Blue Cross Blue Shield insurance. So if you are looking to pursue an evaluation for your child and you have Blue Cross Blue Shield, we do know that there are a couple of different options in the area that have an interdisciplinary team for the eval and that accept that insurance. So one of them is the University of Michigan, and then the other one is Henry Ford. And then in addition to those, there are also evaluations available at Sumfield Center for Autism and the Ann Arbor Center for Developmental and Behavioral Pediatrics. So those are also options in the area, but today we're focusing more on what happens when you go in for an interdisciplinary evaluation, because you meet so many individuals. We just want you to be prepared with who all you're going to be seeing and who you can direct questions to for what, as well as just kind of what to have prepared for each of them. So the first person you could see is the developmental pediatrician. So the developmental pediatrician is going to be kind of like when you take your child in for an evaluation at the normal pediatrician's office. You might see a physical that the doctor does with your child. They might ask you about medications that your child is on, so you should have a list of medications ready to be able to give the doctor. They might ask you about hospitalizations or surgery that your child has had, so make sure you're thinking about any hospitalizations or surgeries. They're all important to report. And then they might also ask you questions about your family history, so things like mental illness, genetic conditions in your family. So some of these things are going to be helpful for them to be able to rule out other things that are happening too. So it's important just that you give them as much medical history as possible when you go in to see them. The next person you could see is the speech-language pathologist, so that's SLP, speech-language pathologist. So this is a person who's going to be looking at the speech or the sounds that your child is making, as well as the language, so kind of the meaning behind things that they're saying and things that they're understanding, and then also how they're using their language appropriately with others in different contexts. So the speech-language pathologist might ask you about developmental milestones, so keep in mind when your child started babbling, when they started talking, combining words. If they haven't met all those milestones yet, then that's something that will come out in the evaluation with the speech-language pathologist, and it's something that's important to tell them as well. If they do have words but they're limited, it would be important to have a list of the words that they can say and to think about how they're communicating with you the majority of the time. They might also ask you about when your child's hearing was last tested. So they might not need a specific date, but more of a general idea of if they've had their hearing tested recently. If your child is young and you're not sure if they've had their hearing tested, they all had their hearing tested most likely when they were a newborn at the hospital. If they didn't have to come back for another hearing test after that, they probably passed their newborn hearing screening. But if you have access to that information, that's really important to be able to tell the speech-language pathologist to make sure they're hearing all the sounds in their environment. And then the next person you can see is the occupational therapist. So that's OT, occupational therapy. These are people that are going to be talking to you about sensory needs with your child. That comes up a lot with autism. So if you have concerns about things like your child being very sensitive to an itchy tag in their clothing, or they're very sensitive to sounds or not reactive to certain things as well, those would be important things to talk to the occupational therapist about. Something that also comes up a lot is with feeding. So if you notice them really staying away from certain food textures, that would be something to bring up to OT as well. And then occupational therapy is also going to ask you guys about everyday activities that your child does. So if there's anything in particular that your child has difficulty with every day, like putting their shoes on and things like that, that will come up with OT as well. Next is a social worker or a psychologist. So this is the person that usually gives the big autism test that people hear about. It's called the ADOS. That's the Autism Diagnostic Observation. So that's basically an opportunity to observe the child's behavior in different scenarios, and it's pretty play-based or natural for the child. And then they will interpret the results of that and discuss with the rest of the team as well some of the behaviors that they observed during that test. And at the end, it's always possible that you could be referred to other professionals as well. If there's concern about your child's hearing, you might be referred to somebody like an audiologist that could look at your child's hearing more. If there's concern about restricted diet, from not eating a lot of different foods, they could go to a dietitian to look at their nutrition, just make sure they're healthy. Ongoing therapies with these or with physical therapy might be recommended on a regular basis. And then you could be recommended to go to another doctor as well for things like genetic testing to look further into what's going on. But at the end of the day, hopefully you will have more answers than you came in with, and this is a team here that may vary slightly depending on where you go, but ultimately we'll be able to tell you about a lot of different areas that they have expertise in. So hopefully that gives you a good idea of what to expect, what things to have prepared, and if you're pursuing this process, good luck, and let us know if we can do anything. It's not recommended, or it's not always necessary to bring in prior evaluations and treatment reports and things like that from speech or occupational therapy if you have been having that. But sometimes it's helpful for the team just to give them more information. So if you're pursuing an evaluation and you do want a hard copy of a report that we have or any records that we have, let us know and we can send that over to you as well. And we will see you next month for our next monthly vlog. Bye-bye.